Hi, I'd like to welcome everybody to our podcast. My name is Vincent Dolce. We're here with Marissa Dolce. Marissa is a hygiene consultant. Hi, Marissa.
Hi, how you doing today?
Good. Would you give us a little background? People don't understand we're a dental family, and you are our hygiene expert.
Sure. I have spent my entire career in the field of dental hygiene, practicing leadership, coaching, training, worked for several large dental service organizations. And over the last year, I started my own and founded my own dental hygiene consulting company,
Beautiful.
Oral Health Solutions.
Beautiful. So, Marissa, when you go into a practice, what do you look for when evaluating a practice? What's the first thing you look at?
Well, for dental hygiene, I generally am going to look at average daily production.
Okay.
Daily production is a great barometer because it reflects what's going on within that practice. I'll also look at how many patients the hygienist is seeing per day.
Okay.
So
Super. And,
those are both important numbers.
okay. And what does it take to train the hygienist? What do you have to do to get the hygienist to work the way you want?
First, I need a willing participant, right? I've been
Okay.
training hygienists for so many years, and what I find is when someone is willing to be trained, it makes the job very easy. But you have to have your analysis first. Then, based on the analysis, I can tell where we need to spend more time coaching. This involves chart review or case study, right? We go right into the hygienist's charts and see
Okay.
the pathway that they've taken from a clinical standpoint. And then chairside coaching. Chairside coaching is the most effective method of training.
Now, what exactly do you do chairside with the hygienist?
Well, I'm basically in the room in the operatory with the hygienist for the assessment,
Okay.
presentation, and treatment planning. After that, I leave the room. I'm not introduced as a coach or anything, just another hygienist helping out. And I will have had a little bit of a huddle with the hygienist prior. So we look at the patient's chart and
Sure.
look at the likely path we'll wind up taking. And then it's an interactive training. I may present to the patient to have the hygienist watch me. I may watch them, and then again we have a post treatment huddle as well
Okay.
to discuss what went well, verbiage, etc.
And this isn't a one-time deal. You have to go back, no, and make sure everything is working the way you guys planned.
Well, oversight and accountability is important.
Okay.
And the chips coaching, it could take one day, and
Okay.
because I usually dedicate myself to a hygienist, sometimes it's multiple hygienists, but some people, respond very quickly in a
Okay.
day. Some people require more, but it depends on their skill set, experience, etc.
Okay. So as a dentist, what can I expect? An increase in production volume with this hygienist once you train her or him.
Well, or him.
Yeah, could be.
Uh, Basically, I usually look at increments of $100 per day.
Okay.
Um, uh, and for instance, if a hygienist or if you had, let's say if you had two full-time hygienists
Okay.
in a private practice even, and they increase their daily production by $100, that would yield $50,000 on an annual basis.
Wow.
Now,
Wow.
the growth would be way more than $100, but that's pretty much the minimum.
Okay.
So $200 a day would be 50,000, excuse me, 100,000, et
Wow.
cetera. So this is real dollars, but and it's really just about doing the right thing for the patient. I would also look at the operations, right? Because When you have a hygienist seeing 5 patients a day, um, we can't go to the bank with that, right? We have to work on the hygiene schedule management, that those operations as well. So I work both pieces.
Yeah, most times the schedule isn't the way it should be, right? I noticed the practices that I've gone into, they allow a lot of time for hygiene. Like an hour and a half. I mean, uh, you know, how do you fix that? Or
Um, well, 1 hour is pretty standard. It is the
okay,
industry standard. So I'm fine with that.
okay,
The longer appointments, albeit in a perfect world, if you were, a lot of people want an hour and a half for a new patient. The problem is the risk,
right,
right? The risk is that if that patient doesn't show, again, because as clinical as I am, this is a business and I can't have a hygienist, especially that wages are very high, sitting idly for 90 minutes. So I stick to 1 hour. If there's a difficult case for initial therapy, I'll tell the hygienist do one quadrant at a time if it's really a very difficult case, rather than scheduling additional time.
okay. And what is like the average production for a hygienist that you see, and what is something that you can reach for? What is the goal?
Sure. And it's interesting. I generally work with small groups,
Okay,
small dental service organizations, and I've seen $500 or $600 a day,
okay,
up to $800 a day.
okay,
Um, for a solo hygienist, single column, and again, with the increase in wages, I would want a goal of at least 1,400 or
wow, okay,
1,400 for assisted hygiene, which I'm a very big fan of that model.
okay,
A minimum of 1,800 because, of course, you have a dedicated assistant with a hygienist, and it's not a hard number to get to because there's additional patients on the schedule.
okay.
So the
So
hygienist works 2 rooms.
okay, so they're not. Do they Are they rushing through the procedures, or with an assistant? I imagine it's easier.
It's you have to have an assistant. It
Okay,
cannot be done alone.
okay, got it.
And the appointments are 1 hour staggered with 30 minutes of overlap.
Okay,
So it they function very much like a dentist would function.
got
The
it, got it.
assistant starts the appointment, takes the radiographs, blood pressure, etc., chief complaint, all of that. The hygienist comes in and does their procedure,
Okay,
and then the assistant closes the appointment, right? The assistant is there for the exam with the
got it.
doctor.
And at that production level, it's not a problem to pay for two people to be working.
Correct.
I mean, yeah,
1,800,
that's a big
is
number. That's a
really,
nice number.
that's a minimum.
Okay,
I've had many hygienists do, produce, you know, 2,500 a day,
wow,
those kinds of numbers. And again, if they're doing prophies all day, well, that's not going to
not gonna
happen,
happen. Yeah.
right? It's about the content of the procedures.
How long does it take you to bring a hygienist from seeing one patient an hour up to that level, of doing 1,400, $1,800 a day?
It's definitely a process. And I will say my ballpark, what I usually say is about 3 to 6 months,
Okay.
but I've had people respond in 1 month.
Wow.
So it really depends on the skill set of whomever is being trained. Um, but so 3 to 6 months is fair because, and
Okay.
depending on how much you work with them, right? I'm working with a group in the Northeast and I'm there a week, a month. And we
Ah,
do
okay.
some virtual training. So the training is on site, hands on, and then some virtual as well.
Wow. Cool. And we all work from self-interest. So what does the hygienist get out of this increase in production? I mean, what is a fair because you have to get the dentist is probably going to say, what do I pay her? And she's going to say, well, what do I get for doing all this production?
So again, working with groups, most groups pay hygiene on a percentage.
Okay.
We don't change the hourly rate for what they do. Most groups do about 30% of production.
Wow.
And some groups will do 30% and back out products because there's a cost associated with those. So they may back out that product and the hygienist may get a flat fee or a dollar amount compensation. Let's say a tube of MI paste, they might get $2. But they still have, so they have an opportunity there on products, and then they have an opportunity on production. Some put it all together, which is the easiest way to do it. But so the hygienist is rewarded for doing the right thing for the patient. And I can't, we're talking business, but I can't emphasize that enough. The way hygiene grows is through addressing the patient's condition, screening every single patient every time, which does not happen even in small groups. I worked with a group where they probed once a year. So periodontal once a year. So periodontal pathogens occur, established every 90 days. So we have to check every time. So you increase that assessment, you increase the percentage of periodontal procedures and everything that goes along with it, adjunctive therapies, et cetera.
That's beautiful. That's beautiful. Yeah, I know. A lot of dentists look at their hygiene department as kind of like a lost leader. They pay them, they're not happy about paying them a high salary, and they're not getting the production. So I imagine this is like ubiquitous in most offices, I would imagine.
And even in some groups that I've talked to, the hygiene is really underperforming. So, and when I say underperforming, everybody is hurt by that, right? The patients are not getting what they need.
Right.
The hygienist doesn't cover their salary, and then the organization is at a loss, right? So, so it's not just private practice, but some groups as well. Many groups understand this. And when your hygiene is productive, it can raise your EBITDA. So your profitability will go up exponentially because hygiene is paid at a lower level than the doctors.
That's most important today with the costs of everything in the dental office.
That's right.
Everybody, including the dentist, has to be accountable for production. That's beautiful. I never had that in my practice, so it's an advantage for dentists. And are you available for a consultation?
Yes, I am. I do a free analysis and consultation for anybody interested in working with me, or anybody interested in seeing what the potential could be.
Yeah, so dentists don't sit on the fence. Talk to Marissa, find out what the possibilities are in your hygiene department. Bring your hygiene department up to where it should be, and everyone wins, especially the patient.
Right. Exactly. Wonderful.
Thank you so much, Marissa. And I'll put your information so that people can get a hold of you. And we'll see you soon.
My pleasure. Bye.